By far, the most common question I get as a therapist is, am I normal? Sadness or depressed mood is a totally normative experience or emotion, but it's all a matter of degree. So let's take a look at the full spectrum of depression and answer the question, is this normal? Hi, I'm Dr. Jamie, a licensed clinical psychologist. If you're dealing with loss, relationship issues, or problems at work, you may say that you're depressed. Thinking about depression can be challenging because people use the term to describe an emotion as well as a mental health condition. Let's start with depression as an emotion. When people say depression, they're generally thinking about sadness that's unusually high in duration, frequency, or intensity. And that experience of depressed mood is a totally normative part of the human experience, especially in response to specific events or specific life circumstances. Sadness or depressed mood can be a healthy and normative response. It could help you process grief. It could help you learn more about yourself by understanding your preferences, that's your likes and dislikes. It can also help motivate you to adapt to life challenges. Depressed mood is part of the normative human experience that you can get through with the proper support network, family, friends, and self-care. But there are times when this emotional rain shower turns into a full-on rainstorm. What people commonly call clinical depression is a mental health diagnosis called major depressive disorder. As with all medical diagnoses, it's important to understand that everyone's individual situation might be slightly different. Only a licensed mental health professional working directly with the person could make a diagnosis of major depressive disorder. The mental health professional will assess for the following 9 symptoms of major depressive disorder. An individual is required to have 5 of these symptoms happening roughly around the same period of time to receive a diagnosis of major depressive disorder. The first symptom is the most common thing we think about when we think about depression, and that's depressed mood. Depressed mood is feeling depressed or down for most of the day, nearly every day. Sometimes you notice that you've been depressed or down, sometimes other people notice that you've been depressed or down, and that sadness persists for about 2 weeks. Depression isn't always overt sadness. Sometimes it looks like disinterest or loss of pleasure in things that you used to enjoy. This second symptom is marked by a decrease of interest and pleasure in all or almost all of the activities that you used to enjoy, again for most of the day, nearly every day, for a 2-week period. Either sadness or decreased interest or pleasure are required for a diagnosis of major depressive disorder. If you have one or both of those symptoms, along with at least 4 other symptoms that we're going to be discussing today, you might meet the criteria for major depressive disorder. There are 7 additional symptoms that a mental health provider would assess for in consideration of this diagnosis. The first additional symptom is change in appetite or weight. Some people's sadness or disinterest results in a decrease of appetite and weight loss. For others, you might see an increase in appetite and an increase in weight. What we're looking for when we identify if you're having normative fluctuations in your weight and potentially a temporary change in your feeling about food is a change of more than 10% of your body weight. An increase or decrease greater than 10% might indicate that this is a clinically relevant symptom. Next is sleep disturbance. And just like appetite, some people find that they want to sleep a lot more, and some people find that they want to sleep a lot less if they're having symptoms of depression. There are also other sleep disturbances that can be indicative of this disorder. For example, some people have difficulty with sleep onset, that's trouble getting to sleep. Some people have disrupted sleep, so they're waking up multiple times in the night. Some people have early morning waking, trouble getting back to sleep, or waking up really early in the morning, and ultimately not getting the desired duration of sleep. Now, it's normal for us to have some variation in how we sleep, and maybe even some difficulty sleeping depending on some of the choices that you're making during the day. But what we're looking for when we're assessing for sleep disturbances within the context of major depressive disorder are 3 distinct things. First off, is it happening nearly every night? Secondly, is it happening in conjunction or at the same time as these other symptoms that we've been discussing? And finally, is it causing some sort of impairment during your waking hours? In addition to the symptoms that we've discussed, some people experience what we call psychomotor aberrations. So this could be moving or talking more quickly than what's usual for you, or moving or talking more slowly than what's usual for you. Humans tend to vary the rate of verbal production and other things related to speech, like volume, rate, rhythm, tone. All of those things have normative variations as you go through your day. But assessing for the symptom usually requires an external party. Other people seem to notice that you're either moving or talking more slowly or differently than what's usual for you. In major depressive disorder, you tend to see a general slowing of those capabilities, but the criteria also allows for a quickening of these things. It could present like irritation or being quick to snap back at someone, or it could be indicative of a different mood disorder. We see a lot of fast talking, potentially loud talking, along with a flight of ideas in bipolar disorder. And if you're interested in a similar video on what is normal or pathological about fluctuations in your mood related to bipolar disorder, go ahead and give this video a like and leave a comment in the comment section below if there is another disorder that you'd like me to explore in terms of normative versus potentially pathological behavior. The next symptom of depression is fatigue or loss of energy. This can present as persistent tiredness, physical weakness, or feeling exhausted when completing normative daily tasks. These feelings of tiredness or exhaustion are more than you would typically see after having a long day or not having enough sleep. This is a persistent tiredness, and there may or may not be a specific physiological reason that you can point to for being tired. The seventh symptom of depression could be feelings of worthlessness or excessive guilt. Some people could be overly self-critical, and others could hyper-focus on shortcomings or perceived past failures. And some have guilt about things that they've done or haven't done, or things that they could have done better. Now, it could be that your personality is such where you have a high locus of control. You feel like your individual actions contribute disproportionately to the outcomes, and you might discount the environmental or contextual reasons why things might go well or why things might go poorly. Generally, what we see in depression is taking excessive responsibility for when things go wrong and not acknowledging your contribution when things go right. Now, part of this is because we all are biologically programmed to have a negative cognition bias. In fact, I made a video about these types of biases, and I'll leave it in the cards section up above. The eighth symptom of depression could actually make this bias worse because that's a decrease in your ability to think clearly, concentrate, and make decisions. Individuals managing depressed mood sometimes have difficulty in their ability to focus. They feel like they're walking through life in this bit of a mental fog and can have difficulty making decisions even when the decisions seem simple to an external party. That last piece really differentiates people that are having passive depressed mood from individuals that potentially meet the criteria for a diagnosis of major depressive disorder. It's usually the scope and scale of the problem. So we'll all have some challenging decisions to make in life, and you may find that your ability to think or concentrate changes throughout the day. But managing major depressive disorder means that you have difficulty thinking and concentrating throughout the day in multiple areas of your life, and problems with decision making may not reflect that it's a complex problem, but more that you're having problems making seemingly simple decisions. Finally, some people have recurring thoughts of suicide or death. If you're having thoughts of suicide in the US, you can dial 988 24 hours a day, 7 days a week. You can also text HOME to 741741 from anywhere in the United States to speak to a trained crisis counselor. Although these thoughts on their own are not a medical diagnosis, it is something to discuss with a mental health provider or a trusted contact. Give others the chance to help. In addition to these 9 symptoms, people often overlook the additional considerations mental health providers take into accounting when considering if you're having a normal period of sadness or if you're meeting the criteria for major depressive disorder. A mental health provider is going to determine whether or not these symptoms were happening all during the same period of time. Sometimes we have sleep disturbances for a few weeks, appetite changes during the winter months, disinterest in things that we used to enjoy during another time period, and it's generally normative to experience these changes over the course of your lifetime. But when these things are happening all at once, it may be indicative of a mental health problem. A mental health provider will also assess whether or not these symptoms are having a negative impact in one of your life domains. That could be work, home, social settings, or other domains in your life. Although this is not so common, some people can meet criteria for a disorder but find that they don't have any specific impairments. These individuals can have a personality style where they've generally adapted to having these low levels of depressed mood over long periods of time, or it's possible that we just don't see these high-functioning individuals within the context of research settings or clinical settings, so we don't know too much about them. But at least theoretically, there could be people that meet 5 to 9 of these criteria, but then don't have the impairment in any of those life domains that's required for a diagnosis of major depressive disorder. Lastly, and one of the really important reasons to seek out the assistance of a mental health professional is that these providers are able to identify whether or not your symptoms of depression are better accounted for by another medical problem or potentially another behavioral health diagnosis. Things like substance use or withdrawal could also impact your mood, as well as several of the other symptoms that we discussed today. And since you've made it this far into the video and you're probably a person that doesn't mind getting into the weeds, sometimes these symptoms could also be better explained by another diagnosis or another process. You could be going through some complex grieving, or you could be struggling with another pervasive or severe mental health disorder that also has some of these mood symptoms secondary to that disorder. Mental health professionals such as psychologists, social workers, or other licensed therapists are here to provide support, guidance, and evidence-based interventions to help you navigate through these challenging times. Even if what you're dealing with doesn't rise to the level of a clinical diagnosis, it is almost universally beneficial to have someone to talk to. If you need to talk, reach out to someone. Seek out a trusted friend or professional. Seeking help could be a sign of strength, not weakness. Just like we seek help for medical ailments, it's equally important to look out for your mental health. And if you're curious about the mathematical and psychological concept of normal, consider hitting that subscribe button. I'm working on a video where I discuss the mathematical and psychological notion of normal, and once it's up, you'll be able to click on it right here.